Hey, welcome back, Amador County. Joined this morning with Jackson Creek Dental Group, Dr. Simpson, Dr. Kinzer. Good morning.
Good morning. How you guys doing?
You're good. We got some interesting things here on the table, and we're going to talk about some dental implants this morning.
Sure. Why don't you start?
Well, we actually, this year we went to a course called Maxi Course down in Loma Linda in Southern California. And it was a course on implants. Probably the primary reason that we have chosen to get more education on that is because it's the standard care now in dentistry. More and more people are seeking implants, and we're always trying to stay current and educated in treating the needs of our patients. So we went down there for, 10 months? And,
yeah, 10 trips down.
Yeah, 10 trips down to Southern California throughout the 10-month period of time, and had about 350 hours or so of education time on that, and lots of hands-on experience and stuff. So we thought we'd come and share what's going on in the world of implant dentistry. So.
Great.
So, why implants, right? And we think of something that is fixed makes a lot more sense, right? But this, if anybody's ever seen what a denture looks like, this would be somebody that would be missing all their teeth, and to try to keep this in their mouth is a lot more difficult. So to find ways to attach teeth, whether if you look, I don't know if you can zoom in on this one here, you look in the front, you can see this metal tooth right here. And you can see the metal inside. That would be if we did one tooth. Mm-hmm. So a person may have been in a traumatic accident possibly, and a tooth knocked out, or lost a tooth due to decay or whatever. We can actually put a single tooth in, and in this example here you can see, you can kind of go in, you can see that we have actually teeth that are attached to, if you look inside the clear jaw there actually are implants that are holding that in. Mm-hmm. So you think of something that's attached.
So that's a whole denture type product.
Correct.
That's
correct.
Now permanent, so they don't.
Doesn't come in or out.
Okay.
Right.
So it's a substitute then for a denture.
Substitute for teeth. What I tell my patients is that it's the closest we can get to real teeth, to having
right.
teeth. Chews the same, feels the same, and their experience is going to be the same.
Oh.
Yeah. So we have some here. This is a similar one here where you can see the implants down in the jawbone. And on top you can see single tooth implants. So if you lost a single one maybe in an accident. And then here we have bridge supported implants. So you had brought that model on the bridge.
Oh, yeah, so conventionally, if you go in here, this would be what we would do, it's called a fixed bridge, right? And so in this case, there are two teeth that were prepared down. So when we do a bridge, we have to cut the teeth on either side down, and then we make something that kind of looks like this that goes over the top of it, and that gets fastened, cemented onto the teeth. So when you're looking, I'm cutting down teeth that may or may not need to be. Also, when I'm doing a bridge, I'm connecting teeth together that aren't supposed to be connected together. So an implant would be something more like this, where we've got something that goes in, so that it ends up looking like a little metal post like that, and then the tooth actually goes over the top of that and attaches to that, so you have a situation where it's just permanently fixed in there.
So the big advantage there, of course, is when you're not connecting your teeth, it doesn't matter what happens to these teeth, you still have the implant.
Gotcha.
Implants, statistically, bridges, they typically last about 17 years on average. I've seen them last 40 years, but I've seen them last a few years, and a lot of that has to do with the patient, their mouth and how they're taking care of it, things like that. But with an implant, it'll never decay.
Is decay a bigger problem with a bridge?
Yeah.
Keeping the clean under the...
It's hard to keep clean, but also they are teeth. They do
right.
decay, and an implant won't decay. So no matter what happens to these teeth, you can always use that implant. You can always take this crown off, and you can replace this part with another part for, say, attaching a bridge, a removable.
Okay.
So
seems like they've come a long way in dentistry.
They really have. So. This is an interesting picture here. Something that happens when we take teeth out of a jawbone, right? The bone, this would be a lower jaw right here, okay? And if you look at the progression, see how the jaw is getting smaller and smaller and smaller. So this would be somebody that just had their teeth removed, And then this would be 5 years later, 10 years, 15, 20 years later. So what's happening is you see the jaw is actually literally melting away. And so having a tooth and keeping her teeth is always going to be our first priority. Now, if we can put an implant in the jaw, that implant serves like a tooth, so it will also help maintain jawbone. You think of facial support, you know, we have teeth supporting our jaws, but then also our bones support our face. So not only are we concerned about having something to chew with and function food, but we want something that's going to maintain our face and our smile line and lips that aren't caving in.
What causes this deterioration?
Basically, bone only sticks around as long as there's forces on it. So as soon as you take the teeth out, the bone is no longer needed, so it atrophies away. You remember the astronaut that went up in space several years ago for like 6 months, and when she came back to Earth, they put her in a wheelchair when she got off the plane. It's because her bones had atrophied due to lack of forces on them because there's no gravity. And so they were afraid that when she got off, she could actually potentially break a leg. So the same thing happens here. You get that deterioration of bone. Now, a lot of people are not at the point where they can make a decision where they've just taken a tooth out and they can put an implant in. And these are people that have been in dentures for a long time, and they have mobile dentures. They're moving around a lot, particularly on the lower, because on the upper you get the advantage of suction off the palate. But on the lower, the only thing that holds your denture in is gravity and the tongue. So,
and then there, like you said, those bones aren't being used for anything.
Right. And so over time, they actually go away faster. And an ill-fitting denture, one that's moving around a lot, will cause the bone to deteriorate even faster. And so a lot of what we're doing now for these patients are where we just put in 2 implants here in the chin, because there's almost always enough bone down in the chin region. And so we can just put in 2 there, and then we put little snaps on the inside of the denture. And then those will actually snap on top of it and hold that in.
Oh, okay.
So that helps those patients quite a bit.
Jackson Creek Dental Group, located French Bar Road area by across from Taco Bell.
Taco Bell, yes.
Yeah.
Right there on the corner. Been there for
just a few years.
Just a few years. Yeah.
We don't like to.
Yeah.
I was a child going there.
Much younger.
Yeah.
We've all kind of grown up and watched the technology improve, and
It really has. We do have a special X-ray machine now that takes a CAT scan X-ray. Probably the biggest advancement with implants is the issue with when we're realize we're drilling a hole in the jaw, which seems painful, but the discomfort that patients have from an extraction is usually worse than actually placing an implant. It's just amazing, and I love calling my patients the night after we do surgery, and they're going, well, I'm not feeling anything. They're waiting for it.
Actually very
But a big issue was that there's nerves inside our jaws. There are sinuses. When you look at the skull here, and we take the top of the head off, and you look down inside, these are called maxillary sinuses, and these sinuses are up above the roots where we would place these implants. These are structures we do not want to place the implant into, correct? Hit a nerve, you're going to be numb, right? We go outside the jaw, we could run into a blood vessel and have really bad problems. So what we've done is we have an X-ray machine that X-rays these jaws, and then what we do is we take models, okay? We create a model, and we take that X-ray and bring those things together, okay, to create a way to guide the surgery. I want to explain that process a little bit more.
Well, these models that we're given, these are generated by the lab. They actually take that 3D X-ray and they print out a model of the jawbone. So this is actually a 1-to-1 ratio of the jaw. And it has the nerves and it has the teeth on it. And from that, then, they can make a guide. Well, actually, before that, on the 3D software, we actually place the implants on the X-ray. And so we can place them in relative to the nerves and the teeth and everything. And from that then, they make this model, and then they can make a guide which has sleeves in it that fits over that.
That's cool.
And so this would be the mouth here.
Right.
And so that actually guides the depth and angulation of those drills extremely accurately. And so it takes away a lot of the potential trauma to vital structures like nerves and blood vessels.
So if somebody wanted a consultation to kind of explore this with you guys, what would be that process?
Well, we start with a clinical exam, and just looking at the jaws and jaw line, we can pretty much see the bone. We start with some of our two-dimensional x-rays. Could be the Panorex, which we probably a lot of us have had those. Then eventually we do want to get that CAT scan x-ray, and we can then determine depth of bone and size of bone. And there's cases where sometimes there's not a lot of bone there, and we actually can get bone to grow. So we can graft jawbone material from themselves. We can transplant bone material. We have what we call particulate, which is like chopped up bone from cadavers, from donors. We use cow jaw bone. We've used cow jaw bone has been used in orthopedic surgery for many years for hip placements and things like that. A lot of what happens in orthopedic surgery has come to dentistry in this process of building bone and placing these implants. Same thing with the material. The materials, it's a titanium material, alloy, very strong. It adapts very well to the tissue and creates the ability to be able to fasten something to the patient's jaw.
Great. Got a number of dentists and hygienists that work at your office there?
We do, yeah. We have, 5 doctors, 5 dentists, and an associate. We have our periodontist who's been placing our implants for us for the last, 6-8 years or so. Yes. And he's done a fantastic job of that. We've learned a tremendous amount from him as well. And now we're just starting to integrate it more into our practice as well and doing them ourselves. You asked about hygiene. Yeah, we have, I don't know, I've lost track.
8 hygienists.
7, 8 hygienists. Yeah.
Which is the preventative maintenance to...
Right. And that's important with implants. You still do need to maintain them. They won't decay, but you still can get bone loss around them if they're neglected. And so some people think that, I'll get implants and not have to worry about my teeth anymore. Right. Yeah, it's not the case. You still need to maintain them for sure.
So get out there, brush 3 times a day. Is that still recommended?
It's good, yes. We do recommend
Essentially,
that.
it's more like a tooth than dentures are.
Correct.
By far.
Correct.
Yeah, and it functions like it. I mean, they feel like teeth, and you still have that stability. So your chewing efficiency all goes back up. Chewing forces.
I know years ago when I started practicing, and I'm counseling my patients on do we go to dentures or not. Mayo Clinic, famous clinic, did studies years ago, and patients can live up to 10 years longer by keeping their teeth. And we feel a lot of that is the ability to be able to chew their food and eating better food. You think of vegetables and the foods that require that chewing motion are going to be much better for your body and create those nutritions that we need. So this is going to get us closer to that.
It's really funny how the medical field and the dental field are treated as separate and distinct things, but really that's not true.
It's not.
I mean, they're so interrelated, and that story's not told well.
Right. We have on our exams aren't just about the teeth now. I mean, we're talking about digestive problems. A patient may have intestinal issues because they're not eating properly.
Right.
And so we're discussing medications that the patients are on. We're referring back to physicians, whereas physicians are also referring to us to help us to make sure that these patients are chewing well and comfortable.
Great. Gentlemen, thanks for coming in the studio this morning.
Thank you for having us.
Always a pleasure.
Thank
And
you.
always good to get caught up to date on the dental field.
Thank you.
Great. We are going to run to an ad break. We'll be right back. Stay tuned.
You're watching Amador County's local television network.